The story of Chase Brexton Healthcare cannot be told without telling the stories of the LGBT rights movement, the HIV and AIDS crisis, or the battle for access to equitable healthcare for all. With only a few minutes to share a story 40 years in the making, we cannot give these events the depth they deserve. So, we have compiled many articles, photos, and links to websites of interest that we have gathered online at chasebrexton.org/more to the story. In 1970s Baltimore, LGBT individuals were at the mercy of a healthcare system that did not understand them and often harassed, outed, or denied them care. Across the nation, LGBT people were mobilizing, and in the decade after the Stonewall riots, more than 1,000 LGBT organizations were established across the nation in the 70s, including, in 1975, the Baltimore Gay Alliance. Along with establishing the Gay Community Center of Baltimore, today's GLCCB, and with instrumental assistance from the Baltimore City Health Department, they secured a $10,000 grant for the Centers for Disease Control and Prevention. In 1978, Baltimore's volunteer-run gay health clinic for sexually transmitted diseases was opened. 2 hours, 2 nights a week, and for a donation, LGBT folks were able to get a thorough STD checkup. The work was rewarding, but a struggle. Volunteers battled blatant and covert homophobia from their bosses and the clinic's landlord, and struggled for financial support. As one of the clinic's first providers, Dr. Bernie Branson, noted, "The clinic runs on a shoestring budget. Where else can you get to see a doctor for $5? More services for VD are available at the clinic than through private doctors, yet it could all disappear before you had time to say homophobia." By 1981, 6,000 individuals had received care from the clinic, and while the CDC and the New York Times wrote of a mysterious gay cancer, the clinic was focused on local concerns: syphilis, gonorrhea, and hepatitis. Shortly after the clinic moved into its own space in the GCCB building on Chase Street in 1982, everything changed. When young, otherwise healthy men began getting the telltale cancers and infections, the clinic and the many providers in the community knew AIDS had arrived in Baltimore. The lack of testing and treatment options, confusion about the disease's cause, and the overall loss and pain was breathtaking. At least half of those with AIDS would die. As discoveries and advances were made, the clinic grew, becoming one of the only 2 anonymous testing sites in Baltimore. And in 1986, the newly named Chase Brexton Clinic received a city grant to add HIV medical treatment services 1 night a week. The clinic feared not being able to manage the need. Within the next few years, though, Chase Brexton Clinic, known for its expertise, was open 5 days a week, adding psychological services, launching HIV plus support groups, and taking new patients who had to be turned away by Johns Hopkins' overloaded Moore Clinic. The AIDS crisis brought issues that became points of contention and division. In 1989, the clinic sought to separate from the GLCCB and independently incorporate to gain access to funding and grants. Many in the GLCCB and community were skeptical of this, saying, without the oversight of the GLCCB, the clinic might eventually be taken away from our community. But the clinic argued, we have to recognize that AIDS isn't discriminatory, so we cannot be. Maybe this first-rate medical clinic is what we, as the gay and lesbian community, offers the community at large. A community already devastated by the AIDS epidemic roiled through a splintering debate which ended with the clinic separating and becoming an incorporated entity. In the 90s, Chase Brexton purchased 1001 Cathedral Street, for which the community donated nearly $290,000 needed for renovations. When it opened in 1995, Chase Brexton unveiled the Wall of Courage, Maryland's only AIDS memorial. Since the beginning of the epidemic, the community and Chase Brexton staff and volunteers had suffered unfathomable losses. This memorial served to honor and preserve those who died as a part of the community. Throughout the 90s and into the coming decade, the organization held monthly memorials in honor of those who died. Chase Brexton would take on greater endeavors for the benefit of their patients and communities throughout the 90s and first decade of the 2000s. They would become the first historically LGBT organization to become a federally qualified health center and the second to receive Joint Commission accreditation. They would become founding members in managed care partnerships such as Priority Partners and Healthy Howard to benefit the medically underserved. They'd add an in-house pharmacy to ensure those without insurance would still be able to get their medicines. They would participate in research and work through many AIDS treatment trials and unique therapies such as hyperbaric oxygen therapy and transfusion. They would receive a special program of national significance grant with evaluation assistance from Johns Hopkins and institute a new type of HIV treatment program involving integrated medication adherence counseling. Patients with HIV were able to receive a continuum of integrated care that enabled them to better adhere to the still complex but more successful heart treatment regimen. Chase Brexton would open 4 centers and begin to provide an array of services, including HIV counseling, testing and treatment, LGBT affirming family medicine, women's wellness, trans care, general dental, nutrition, behavioral health with behavioral medicine, and an intensive outpatient addictions treatment program, case management, nursing services, medication support, pharmacy, and lab services. David Shippey, Chase Brexton's executive director from 1991 to 2011, once noted, Chase Brexton's founders imagined that members of the community could one day seek health care in an organizational environment that would be both non-judgmental and compassionate. It is our challenge today to remain as creative as possible in our approach to sustaining the organization they envisioned. Through failure and success, Chase Brexton took that challenge to heart. In the last decade, the organization purchased the Monumental Life Building, expanded its Columbia, Easton, and Randallstown centers, became the provider of student health services at Maryland Institute College of Art, and established a new center in Glen Burnie. The LGBT Health Resource Center was open to provide resources above and beyond clinical care. OBGYN services were brought on, and the pediatric program Gender Journeys of Youth, Gender Joy, was established and has provided care for more than 1,200 gender-diverse children. Today, as we celebrate 4 decades of community care, the former volunteer-run Gay Health Clinic for Sexually Transmitted Diseases opens its doors and arms to more than 35,000 diverse individuals and remains steadfast to ensuring the legacy of care, the commitment to the community, and the hope that was born with the first patient in 1978 continues to live here.